For the topic of infant deaths, we have two topics to be covered. The first one is infanticide, the second one is SIDS. So as the part 1, infanticide and medicolegal aspects. What are the learning outcomes? Define the term infanticide, the commonest age group vulnerable to infanticide, criteria to be proved in a suspected case of infanticide. Discuss the laws related to infanticide in Sri Lanka. List the difficulties encountered by the JMO. I am not going to discuss that much of that one because it's easy and common sense thing. Enumerate the signs of life and how to demonstrate them in a postmortem, and legal issues. How the defense try to tell other possibilities instead of a case of infanticide. Moving on to the definition of infanticide. Infanticide means killing of a child, that means or infant less than 12 months of age by commission or omission. There should be some kind of action to kill a baby. That means with commission or omission by his or her biological mother. So it is a key that we have to have here. It should be the biological mother due to the mental imbalance caused by the effects of pregnancy and lactation. So these are the keywords that you have to have. Before moving on to much details, let's have a clear discussion about the law of the country. Now you can see the term homicide. So that means killing by another person by a man, homicide. Right. So now there are two categories. The first one is justifiable homicides. The other one is culpable homicide. As you can understand now, this kind of homicides are justifiable. Example, capital punishment life. However, when it comes to this category, it cannot be accepted. That means it is culpable, right? Some kind of faultiness or incorrect should be there. So now law says homicide is prohibited. So that means for this category there should be a punishment definitely, right? So out of the category of culpable homicide, which is described in section 293 of the Penal Code, again has got two parts. The first part is murder, that described in the section of 294. And also the punishment is described in the 296, right? So now to punish a person for the murder, all right, there should be two requirements. That means the judge should prove the case beyond any reasonable doubt that this person killed the another like, right? So what are the two requirements that should have? The first one is actus reus. So that means some kind of act should be clearly visible. That means maybe cutting the neck, all right, stabbing, right, action. And the second thing is there should be a very clear intention, all right. The prosecution should prove that there is a clear intention that A wanted to kill B. All right. Now, if these two requirements are fulfilled, now the person is going to have murder charges. Okay. Right. So now there is another category, that means culpable homicide not amounting to murder. Here actually if there is a death, an action should be there. That means the actus reus should be there. But how about the intention? The intention is not that severe. Sometimes the intention, actually speaking, the person actually don't want to kill the person, but with a sudden provocation it happens, or as a self-defense, and also it is due to the effects of pregnancy and lactation. Otherwise, a mother does not want to kill her baby unless the mother is going to have some kind of mental illness due to the effects of pregnancy and lactation. However, if mother has got a mental illness not due to the effects of pregnancy and lactation, right? So now in this case, if the mother is going to kill the baby, she will get murder charges because intention is higher there. But here you can understand there should be some kind of mercy on behalf of the mother. Okay. As a result, the offense of infanticide, that means mother kills her own baby within the first year of life with the effects of pregnancy and lactation, is going to be considered as an offense called culpable homicide not amounting to murder. This part I am not going to describe here. As a result, the killing of a young child by the mother is a well-recognized medical and psychiatric phenomenon that distinguishes it from other types of homicides, right? So, other types of homicides means it is not a direct homicide, but it is homicide, that means culpable homicide not amounting to murder. Now, you can understand in case of murder, that means the intention is very strenuous and very strong, all right. So, that means a person has killed another. So, what would be the punishment here? Capital punishment to him, or according to the law nowadays it is life imprisonment. That means if you have killed another person, your life also should be taken. So, this is the punishment, all right. However, in case of culpable homicide not amounting to murder, you can understand the intention is now little less. As a result, the punishment is also less. What would be the punishment then? Rehabilitation. In other countries, house arrest, right? So, instead of capital punishment or life imprisonment, in case of culpable homicide not amounting to murder, the mother will get rehabilitation. Moving on to just England and Wales. In England, there is a separate act for infanticide, just to mention, right? So, as you can observe from earlier slides, our law is embedded in murder section, but in England, there is a separate act for the offense of infanticide, just to mention. Let's have a little scenario. Now imagine you are the JMO. Now you will be asked to perform a post-mortem examination of an infant now. So what are the things that you have to tell? So what are the possibilities now? Definitely you have to consider about the possibility of infanticide. All right. So now as per the definition, you know, to tell it as a case of infanticide, the age of the baby should be less than 1 year. And also we have to get the details of the mother, and also we have to tell that the mother was suffering from some kind of psychiatric disturbance due to the effects of pregnancy and lactation. Can I tell it as a JMO? No, I can't. So in this case we have to, or we definitely should take the help of the psychiatrist opinion. Anything else? And then to kill a baby, there should be some kind of action or actus rea, right? So that means some kind of action. Action could have been in the form of commission, right? So maybe manual strangulation, dashing off the head on a wall, right? Commission, or it could be omission as well. So mother can leave the baby on open air without any clothing, so hypothermia, or keeping the child without milk, right? So commission or omission. And also you have to exclude about other possibilities as well. There may be congenital malformations, where the baby can get any kind of natural death, right? So as a result, now you can understand there are certain criteria to be established in a suspected case of infanticide, right? So the first thing you have to tell as the JMO, the baby was born alive and was alive at the time of killing. For that, you have to exclude the possibility of stillbirth. If you can establish that this birth is a stillbirth, yes, we are very happy, because now it is not a case of infanticide, because it is not a live birth. Other criteria, right? Now, child died as a result of either an act of commission or omission that I have mentioned. Otherwise, it could be a natural death as well. And also, the age of the child should be less than 1 year. And what are the other criteria that you have to tell? Maturity and viability. It could be actually a case of abortion, right? So, the baby can't survive alone. The maturity is very less. And also, time since death. Conditions of disposal could be a kind of surreptitious disposal, and mother-child relationship. Right. So, what do you mean by a stillbirth? In England and Wales, usually less than 24th week. Now, they are not going to consider that the baby can survive on her own. All right. But in Sri Lanka, also we are going to consider that if the POA is less than 24th, right? So, we consider that the baby can't survive alone. So, that means maturity and viability, all right, stillbirth. Right. So, now we have to understand this chart, right? If you are asked to do the postmortem of an infant, right? Now, there are certain things that you have to think about, right? So, you have to first of all think about the possibility of a live baby. To tell the respiration and feeding and everything, you have to do full investigation, all right? Right. So, to tell about the liveness of the baby, you have to take certain parameters such as whether the baby has respired, baby had been fed, any cord changes, skin changes, reaction to trauma, and vessel changes. If you can see one of those, so it is a clear evidence to tell that the baby was born alive, all right? And also you have to ascertain about the maturity and what are the actions that was performed to kill the baby, whether it's a form of commission or omission, who is the mother. So in this case you have to take the DNA sample, you have to think about or exclude about natural illnesses, and then finally what is the cause of death like. All right. And then if you can't tell about the live birth, then the next possibility is the stillbirth. That means the baby is going to have the birth as a dead body. That's the meaning of stillbirth, right? So now there are certain other categories as well for the stillbirth. So if you can definitely diagnose a stillbirth, that means the end of the story of the investigation of towards the infanticide, right? So now stillbirth also could be fresh stillbirths and also macerated or old stillbirths as well. So if you can diagnose stillbirth, we are very happy, because we are not going to investigate towards a possible case of infanticide. Now if you can see features of maceration, so what are the features of maceration? When it's fresh, no features at all, but when the dead fetus is going to be within the uterus, there may be certain changes like red color, peeling of the skin, blister formation, Spalding sign, all right. So now just to mention. And then what are the signs of life of the baby, or how to establish the live birth? The first and foremost thing is the respiration, as we can understand. And then if you can see milk inside the baby's stomach, yes, it's a very good evidence to tell that the baby was fed, so it's a live birth. And also there may be blood changes, not that important, and also reaction to trauma, that means healing signs, edema, bleeding, and also with the times there may be skin changes, not going to discuss, vessel changes, and also cord changes as well. You can understand now, if there is a dead body of an infant, now first of all we have to tell whether the baby was born alive or not. For that, there are certain parameters that we are going by. That means the first and most important one is respiration. The other ones are skin changes, trauma, and feeding, and etc. etc. So for that, hydrostatic test, which is very controversial post-mortem procedure, however, you have to learn it because we are going to ask certain MCQs, right? Here we have to dissect the baby's thorax by using very blunt dissection. We are not going to use any sharp instrument, thinking that there may be post-mortem artifacts. By cutting lungs, we are going to artificially make pathway to enter air. Alright, so now as a result, we are going to use Osborne no-touch technique. Alright, so minimal handling and also a blunt force dissection, bluntish dissection. With that, we are going to separate the total thoracic plaque, right? So what do you mean by total thoracic plaque? Both lungs, trachea, esophagus, and then the pharynx, larynx, and tongue, right? So we are going to take this plaque and also put into a water jar. Right, so what are the possibilities now? Right, so what are the possibilities? If these lungs are well aerated, what will happen to the total thoracic plaque? It is going to get floated because of the buoyance effect. Alright, but if these lungs are not aerated, what will happen? Because of the weight, it will get sunk bottom to the water bucket. Right, so now if it is going to sink, that means we are going to assume that the baby had not respired. If the plaque is going to get float, that means we are going to get the idea, the possibility, right, of breathing should be there. Right, so if this happens, as the next step, we are going to cut both lungs from the plaque, and then we are going to further dissect the lungs into small pieces, and then we tend to squeeze the lungs by using a cloth to expel the trapped air, and then we put these squeezed air expelled parts of lungs into a water beaker. So what are the possibilities now? There may be lots of possibilities, right? So now all the particles now are floating. So now it is a very good indication, not a proof definitely, right? So to have that trapped air inside very much, so that means baby breathing is very sure like, right? So what are the other possibilities? All the parts now sunk, right? So now not breathing. And also there may be certain other possibilities as well. What are they? Partly sunk and partly floating as well, right? So in this case we are at doubt, right? So now you can understand, right, the importance of the hydrostatic test, right? However, remember, with the slightest putrefaction and also with artificial respiration, no value of the test, remember. That means there may be false positives and also false negatives as well. So to show, now what do you think about the color? Here the color is dark reddish purplish and liver-like. That means no air, right? So now sinking of the total plaque. Now here two lungs had been separated and again put into a bucket of water, all right? But still you can see now, however, these lungs are floating. So that means due to the effects of buoyance, now trapped air inside the lungs. Right, so as I have mentioned you earlier, there may be false negatives and positives as well. So false positives due to putrefaction, you know, with the putrefaction, air should be there trapped inside, and also with resuscitation. And then what are the false negatives? There may be collapsed lungs. Yes, baby had respired, but due to the collapsing of lungs, right, so there may be false positives, and also with the consolidation with pneumonic lungs as well. However, now you can't use the test with slightest degree of putrefaction, resuscitation, right? Stillborn or unrespired lungs, so this is one of the major duties that you have to tell to the medico-legal investigation procedure. We are not going to describe much about these details. If you are in interest, right, so you can read it leisurely. However, what's the most reliable finding to tell about the respiration? Now, according to the textbooks, it is mentioned as the crepitation and also the texture, that means aerated lungs, and also the appearance, right? So, appearance, crepitation and color are the best findings to tell about the respiration of the lungs. Summary. Now you can understand, right? So hydrostatic test is just a pointer. Though it is positive, we are not going to tell or to confirm that the baby has respired, all right? Because there may be false positives and negatives as well. How about the feeding? Again, there are interesting points that you have to know. How about the feeding? If you can see milk, right, a definitive, right, definitive proof of live birth. And if you can see sand, so that means again the baby had respired certain foreign bodies, right? Again, it's a proof. But and also these foreign things should be beyond the secondary bronchioles as well. And also, if you can see certain endogenous materials such as saliva in the stomach and also blood, meconium, amniotic fluid, all right. So, you are not going to diagnose a kind of live birth because these could be passive passage up to the stomach during the delivery and so on, right. So, what's the difference in between exogenous material versus endogenous material, right? So, milk, sand or any foreign body, yes, but not with endogenous materials. Wound healing, yes, a very good sign, but if you can see just drying of the umbilical cord, you are not going to tell that, oh, this is wound healing. Skin changes, there are many changes we are not going to describe. And tissue reaction to trauma, right? There may be birth trauma, accidental trauma and incidental trauma, and also the purposeful actions as well. However, if you can see bleeding, edema, pus collection, right? So, this is a kind of definitive proof to tell that the baby was born alive. Assessment of the age of the child. You know, now we have to tell the age of the baby is less than 1 year, and also the maturity of the baby is compatible to have a separate existence as well, right? So, from two ends you have to tell about the age of the baby. For that, again, there are lots of parameters that we are not going to learn in detail. Right, so viability can be assessed by gestational age, body weight, body length, external features, right? So, and development of internal organs. Importantly, by studying about the ossification centers. Maturity also we are not going to discuss in detail. Right, so what about the ossification centers, right? So, that means so now at early stages only get hyaline cartilage, and also later on you get primary ossification centers, right? So, now by the time of the term there are certain ossification centers in a baby. So, we have to do certain specific dissections for that, just to mention. Now, ossification centers, you can see this is bisected sternum, right? So now these are the ossification centers. With the dissection, if you can see the first one, then you are going to tell that the baby is more than 5 months as the POA, 6 months, 7 months, right? So if you can see here 8, 9 and then term like, all right? Right. So now there are ways and means, right? So just to tell you, to see about the ossification centers on femur, right? So you have to have dissections like this, right? So have cutting of the femur to see ossification centers, whether it is there or not, right? The difficulties encountered by a medical officer in establishing the above criteria, we are not going to discuss. You can read it leisurely because it's very common sense. However, this part is important. Now, what do you think about diagnosis of a case of infanticide? Is difficult or easy? Remember, it's very, very difficult. The reason is most of the time the baby is killed soon after the birth, all right? So that means it's very difficult to tell about the respiration, feeding or anything. However, sometimes mothers are going to hide the baby to let the baby putrefy and also to destroy the evidence. So in this case, it's very difficult to tell about the possibility of live birth. This results in loss of valuable evidence in respect in live birth and cause of death. Right. As the last part, the mechanisms of infanticide, that means acts of commission and omission. Again, you can read this up, right? So there may be acts of commission or omission to kill the baby. Example, blunt trauma to head. However, now as the JMO, you can see certain injuries on the scalp, around the mouth, on the neck, all right? So ligature strangulation and also features of drowning, smothering, stab or cut injuries, neck wringing, giving poison or burial alive. Whatever the finding that you have encountered, if mother is there, mother will tell a totally different story. So what do you call it? Common defenses. Mother will tell, oh no, I was carrying the baby and the baby accidentally fallen down. And also I tried to deliver the baby on my own. So as a result only, the baby has got certain nail marks and lots of injuries over the neck. But actually it's a case of manual strangulation. So likewise, now there may be lots of injuries and also several defenses as well from the side of mother as well. So these are commissions. So what are the omissions? Omissions means failure in doing certain things. Failure to ligate the cord, aspiration of fluid, suffocation by clothing, by stacking up clothing, right? So exposure to cold, starvation and abandoning the child, right? So what are the defenses? Yes, again you can read this one. Read this part, self-delivery, and also the mother will tell that she was panicked and so on. Right, so now this is the summary slide or the flow chart. Now infanticide, what's the definition? Killing of a child less than 12 months of age by commission or omission by his or her biological mother, all right, only the biological mother, due to the effects of mental imbalance caused by the effects of pregnancy and lactation. And what are the legal aspects? There are two things that you have to think about. To have the criminal liability, there should be two criteria, actus reus and mens rea, right? So in this case, the offense is considered as not murder but culpable homicide not amounting to murder. And then how to prove a live birth, history, scene, examination and physical examination of lungs. Here you have to think about hydrostatic test and also what are the false positives and negatives, and then feeding, right? So now if milk or foreign bodies, yes, but not endogenous things, and also wound healing, cord changes, blood changes, skin changes. And if you are asked to do a medico-legal examination, definitely it is the 10-step procedure, and we are not going to discuss in detail. And what are the defenses, right? So there may be commissions, here commissions, and also omissions, right? So now you learnt about those aspects as well. Now finally, a psychiatrist should play a major role, since the mother should be assessed for her psychological imbalance. You can understand TMO have to find certain things, but another major part should be fulfilled by a psychiatrist. Thank you.